The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Good morning, everyone. It is Tuesday morning, and we are here for the next episode of TMD Demystified. I am Tony Urbanek. Today's topic, get right to it, is what really causes TMD. What really causes, quote, in air quotes, TMJ. Everyone wants to call it TMJ. You can call it anything you want, for sure, but keep in mind it's one disorder. This problem is one disorder. The disorder is chronic inflammation within the temporomandibular joint, which creates all the symptoms. But today's topic, what's really the cause of TMJ, or causes, and there are only three, is what causes the chronic inflammation. Now, chronic inflammation is the common denominator. Follow me along here. Chronic inflammation is the central thesis, the common denominator that creates all the symptoms. And of course, you just don't go on treating symptoms, because you can do that forever. Best example of that is Botox. I think everyone by now knows what I think about Botox. It's great for the pharmaceuticals that make the Botox drugs, but it's not good for the patients. And that's maybe a whole other topic. I'll do a little extra research, because I've already begun the research, and what the side effects of chronic Botox injections are. It deserves some study. It deserves some other independent investigation to be critical of what happens when you use Botox over a long period of time. But anyway, let's talk about the three causes, the three circumstances, if you will, that cause the chronic inflammation, the common denominator, which creates each and every one of the symptoms of TMD. So for anyone new to the site, I do a podcast every Tuesday morning, I record it usually between 9 and 10 o'clock in the morning. And then it's published to be reviewed on Dental Town, on YouTube, and other places. And I hope that it is some substantial assistance in whether you are a doctor, a dentist, a dental associate, a physician, or especially the patients who have no understanding of this problem. It's just a total enigma. And frankly, to many, many dentists, I would estimate probably 2/3 or more of dentists in the United States of America, the concept, the disease, TMD, is a total enigma. In other words, there's without any knowledge. And so sometimes patients know a little bit more about TMD than the doctors do. And that's unfortunate. I've taken the responsibility to solve this issue, to solve this problem, and to bring out the truth. All right, so let's get on with what I have to say about this. I'd like to share my screen. I had AI help me and create a slide which creates the three separate causes of chronic inflammation within the joint. Unfortunately, I may not be able to extract let me see. I may not know how to do this. We'll figure it out. The three causes are bruxism, acute trauma, and functional malocclusion. Those are the three causes. And bruxism is the one that's best known. It is the most common of the three, but there are only three causes that damage the temporomandibular joint. The first one is bruxism, clenching or grinding. The clenching or grinding can be done at night. It can be done during the day. You do not have to make noise with your teeth to actually brux. Half the population clenches and grinds their teeth. There is no on and off switch for bruxism. If you are a bruxer, person who clenches or grinds, then you're likely to do it your entire life. You're not a bad person because you clench or grind your teeth. The only thing we know for certain about clenching or grinding is it is related to stress, anxiety, worry. And we know there is a mechanism within the brain, in the lower aspects of the brain, because you're not aware of this going on. It's automatic, but we really don't understand the mechanism. The only thing we can say about bruxism, it is related to stress, anxiety, and worry. And the more a person is stressed, anxious, and worried, the more tendency they have to brux. So that you can brux more during periods of stress in your life and less bruxism in less areas of stress in your life. And I must remind everyone that stress is a part of life. And some people are stressed more than others. Some people avoid stress. Some people actually encourage stress, take on more responsibility, take on more work, take on more family issues. Neither one of them are bad. You can try to avoid stress. You can take on stress depending on your point of view. But the only thing we can say about bruxism and stress is that they are related. The more stress, the more bruxism. We don't understand the mechanism. But let me make it clear that those who brux, will then damage the joint because of excessive forces on the temporomandibular joint as you clench or grind. And as you know, it causes excessive forces on the teeth. So you can actually break teeth by bruxing too long. You can crack a tooth right down the middle. I have lots and lots of patients who come in that have been long-term bruxers and have lost 1, 2, or more teeth because they've cracked that tooth right down the middle. But bruxism damages the joint, and then that creates inflammation. And if the joint does not go on to heal, then you actually have chronic inflammation, and chronic inflammation is a different subset of cells and cellular exudates, which then can actually begin to damage further, cause degenerative change of the bone and other structures, bone, cartilage, changes the synovial fluid, the characteristic of the synovial fluid within the joint, and you're often running on a decades-long, continual, progressive damage to the temporomandibular joint, and because temporomandibular joint disease is a progressive disease. And then keep in mind that the common denominator, again, is chronic inflammation, and then this leads to the symptoms. And the symptoms for any newcomers are frequent or recurring headache, earache, jaw pain, neck pain, tinnitus, ringing in the ear, subjective hearing loss, a feeling of fullness in the ears like you got water in your ear and you can't clear it, dizziness, vertigo, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, and various kinds of jaw locking. Those are the well-known, well-established. There are some others that are being going to be described later on that I'm working on that I am very confident are also symptoms. The most common one that I'll just mention right now, and that is the feeling of tightness or pain behind the eye. And I've talked about that a little bit on other podcasts, but that is a very interesting symptom that goes along with how this mechanism works within the brainstem, within the reticular formation of the brainstem, sending signals not just to the muscles of mastication, but muscles of the neck, and then muscles of the upper shoulder girdle, and then actually can send muscles signals, autonomic signals, to the muscles that move the eye, and there are three cranial nerves, the third, the fourth, and the sixth, that actually move the eye. The third, the fourth, and the sixth. So the second cause of damage to the joint is acute trauma. Now, the acute trauma can occur at any age, obviously. Once you damage the joint beyond a point of healing, again, then you take the chronic inflammation, which is trying to heal the damage, changes to chronic inflammation, which then goes on to continue to damage the joint. Now, the most common type of trauma to the head that I have seen is whiplash. And whiplash occurs almost exclusively, can happen in falls and other things, but almost exclusively in motor vehicle accidents, where the neck is snapped back excessively, and as that happens, the mandible, the jaw, the lower jaw, snaps excessively open, going back. And when it's excessively open, then you damage the structures within the joint, the meniscus itself, and the ligaments that hold the meniscus in place, initially loosening the meniscus, which then goes on to making that clicking sound that everybody's familiar with. It's one of the first signs. It's not a symptom, it's a sign, is clicking, click, 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 click. That's not a good sign. That's a sign that your joint is going bad. You have not already then experienced some of the symptoms, headache, earache, jaw pain, neck pain, etc., but it's a sign that you have damage to the temporomandibular joint, and that pretty soon you're going to start developing symptoms. So whiplash is the most common type of trauma to the jaw, but it can be, having falls and hitting your face over the handlebars of bicycles as a kid, domestic violence, athletic injuries for sure. I have a whole list of boxers. Obviously, that's part of their job, is to take punches to the chin. After a while, you have a high probability of developing temporomandibular joint problems. However, we do not, interestingly, see anywhere near as many male patients with temporomandibular joint disease as we do females, although males have experience with a lot more trauma. Example, boxers. I have seen several in my career, maybe half a dozen boxers, and they have tremendous temporomandibular joint disease. But as far as all the boxers on the planet, it's not a common occurrence for them to develop temporomandibular joint disease. Why? Because they're males. And it is heavily weighted toward females. The disease TMD is heavily weighted toward females because estrogen exacerbates inflammation. In the literature for 70 years, that fact. That's why it's a female disease. That is why fibromyalgia is a female disease. Estrogen exacerbates inflammation. You do not see males with fibromyalgia. So acute trauma can be many types of trauma. All of them have what in common is overloading, abnormal overloading of the joint. Just like bruxism is abnormal overloading of the joint, acute trauma is excessive overloading of the joint. That goes on then to tissue injury, chronic inflammation, and then finally you develop symptoms of headache, earache, jaw pain, etc. Unfortunately, I'm not going to be able to take this off of, well, maybe I can do this. Let's see what happens. There we go. Let's do it that way. And the third is functional malocclusion, which is overloading the joint because the teeth or jaws do not fit together correctly. The teeth or jaws do not fit together correctly. And that is what will happen is it'll overload the joint over a period of time, and when that occurs, you will get injury to the tissues, and when that occurs, you develop symptoms. So this is what you can expect from one or all three of these types of damage to the temporomandibular joint. It's very, very simple. It's very logical. It's not mystical how you develop temporomandibular joint disease. It is very common to actually have chronic inflammation within the temporomandibular joint due to all three of them at the same time. You can have bruxism, acute trauma, and functional malocclusion, which will then kind of triple your sensitivity or probability to develop multiple symptoms simultaneously. All right, that is the topic for today. I hope that it makes sense to you. It will not be as long as most of my podcasts, but I think that it doesn't need to be as long. For those of you who would like to know more, there are 264 additional podcasts that preceded this one that you are welcome to view on all of the different topics of TMD Demystified. If you are a doctor who would like to learn how to treat this problem with a device a device that literally unloads the joint like a set of crutches, unloads a bad knee, a painful knee, a damaged knee, and you don't want surgery and you don't want injections, then you can have a set of crutches that the orthopedic surgeon recommends, and the knee pain's going to go away. Well, a device that unloads the temporomandibular joint according to a protocol, you have to use it correctly. You can't just use it any old way and expect the results. But if you use it correctly, you will get the results and you will get the symptoms to go away. And if you are a dentist who would like to learn how to do this, all that information is on our website, www.urbanektmj.com. Or if you are a patient who is suffering from these symptoms, you can find out the other doctors in the United States who are already licensed to use this tool, this device, and protocol. We have doctors now in 20 states and growing. About ready to add another one. And that list can be found on our website, www.urbanektmj.com. So I look forward to the next episode that I'll bring next Tuesday. I hope this is meaningful. I hope that if you are a patient, you know that you are now aware you do not have to suffer these symptoms indefinitely. We have patients I see constantly. Every clinic, we see patients who have had these symptoms for decades, 10 years, 20 years, 30 years, some even 40 years, who have been run around in circles trying to find a solution to this problem. And the primary reason why they have been run around in circles is because the dental establishment does not understand the disease itself. They are absolutely married to just trying to treat symptoms and not trying to understand exactly what creates the symptoms, which now you know is chronic inflammation within the temporomandibular joint. And the easiest, the best, and most successful way to treat chronic inflammation within the temporomandibular joint is to unload the joint over a period of time according to a proper protocol. Until next time, I am Tony Urbanek, and this is TMD Demystified.